Hi.
This is a simulation.
We're going to be your nurses today.
Brooke and Alexis are real nursing students at IU South Bend.
Hi, it's nice to meet you.
James Martin is their fake patient.
Yeah, I'm having trouble catching my breath.
In this scenario, Martin has COPD and pneumonia. Brooke and Alexis are supposed to do as real nurses do: assess the patient, take his vitals, and do what they can to meet his needs. This is the first time ever they're taking what they've learned in books and putting it into practice.
See, you're coughing up some stuff.
Yeah, I had that bad cough.
Meanwhile, their instructors are observing and controlling the simulation on the computer behind the glass. This is meant to closely mimic what could happen inside a real hospital.
Because healthcare agencies, of course, are short nurses. And so whatever we can do at the education level to bring them to a higher level by the time they enter the hospital, that's going to help the hospital have a more functioning nurse at an earlier time.
Soon, this type of learning at IU South Bend will be upgraded.
I am so excited about it.
Barbara White is the Assistant Dean of Nursing at IU South Bend. She gave us a tour of the current nursing facilities at the school.
If we can do the quality of education that we do in this crammed space, imagine what we can do when we have appropriate space.
Right now, there's just one simulation room. Space throughout is limited, and in many cases, it's not as realistic as instructors say it should be.
We have what I call a simulation closet. It is a single room, so when they say they have to go and give medications to the patient, they walk 2 steps and there's the medication cart. It's really not very realistic. And it also doesn't give them the whole distraction piece that is part of nursing care.
This is about to change. IU South Bend is in the process of building a new simulation center. Parkside Hall on campus is being renovated into the new Dwyer Healthcare Simulation Center. The new space will house nursing and radiography programs.
So the bed will be there coming out this way. And there will be 2 cameras.
There will be 4 simulation labs, much more space, and more realistic technology and experiences. Leaders say this will reduce the amount of time it will take nurses to be ready for the workforce, and they'll be better prepared.
Our region counts on, and they're seeking out graduates who can be good clinical decision makers. They want graduates who have clinical judgment. And so that's what simulation helps us do, is helps our graduates practice throughout nursing school, having that clinical judgment so then they can be practice ready.
In that simulation with fake patient James Martin.
That's a little low. We're going to put his oxygen on him.
Oh, I took it out because it was bothering me.
How is it bothering you?
It was just tickling.
The student nurses showed excellent teamwork and communication and made correct observations and decisions to prioritize the patient's health.
It's a little higher than it was earlier, so we'll get you some meds for that, okay?
All of these skills are difficult to teach from a textbook and can only be learned in practice.
Education says we can't possibly teach you all the scenarios that you are going to come across with your patients over the course of your 40-year career in nursing. So we need to give you the thinking skills, the critical thinking skills, and the clinical reasoning skills that whatever the patient shows you, in a very different way than you've ever seen before, you will know what to do for that patient to rescue them, to help them, right? Because you have practiced this stuff.
I'm John Paul. Thanks for watching. Here's another video for you to watch. Also, please take a moment to subscribe to our channel.